Hey, this is Sandy,
And Randy.
and we're here on AT Corner.
Being an athletic trainer comes with ups and downs, and we're here to showcase it all.
Join us as we share our world in sports medicine.
Welcome back to another episode of AT Corner. For this education episode, we're taking it to one of my favorites, Star Wars.
You're a nerd.
Pew pew. Yes, I am. So on that note, we are talking about laser. I thought that was fitting. Star Wars, there's a lot of lasers.
Do they use it therapeutically?
Define therapeutic. Pew pew.
All right, what are we talking about in this episode?
Yes, we are going to be talking about laser and how is it therapeutic? Is it therapeutic? So the objectives that we're shooting for will explain the physiological effects of laser therapy, and then we'll discuss the efficacy of laser in treating musculoskeletal injuries, and we'll talk about little performance parameters as well. As I was reading about laser, there was a lot of, hey, how can this be used as an ergogenic aid? Which I thought was very fascinating.
That is really fascinating.
And then we'll try and discuss some of the optimal parameters for laser treatments. We'll get into that a little bit because there's definitely parameters are very varied. That's what I've learned.
Yeah,
Yes.
I guess based on the study.
Yeah.
Based on whoever wants to run it.
Yep, exactly.
So before we get started, this is a CEU episode. If you're listening to it as it comes out, it is free. Thank you to Precision AT. If you are listening to it within our latest three CEU episodes, it will be priced at $1, and anything before that will be regularly priced, but still affordable from Precision AT.
Yep, never too soon to start getting those CEUs reporting here.
Mm-hmm. So, Randy, the big question of the night.
Yes.
Does laser do anything cool?
That is a great question. And I personally think it does a lot of things that are cool, which is probably why we started the episode with Nerd Alert. Yep, Nerd Alert. Yep, you're getting a lot of sounds this episode. I apologize. So to answer the question of does laser do anything cool, we have to talk about what exactly is laser. And we're not going to get like super scientific-y on this one. It's just laser uses red light or near infrared light and basically beams that bad boy right into your tissue and right into the cells.
I mean, we do get natural light just from something really big every day, and that's the sun.
That does shoot infrared light, UV light too, yeah.
Yeah, and that has you think about seasonal affect disorder.
Yes.
You think about how important the sun is, so I would just feel like the laser and light therapy kind of has a lot of the same like background and ideals.
100 ideas. What I was going to say was 100%. Yes. Yeah, no, you're exactly right. And that's why, obviously, like how laser works, as we go into a little bit more, we have cells that are capable of harnessing this light energy from, obviously, the sun and, in this modality. So 100%, light from the sun definitely plays a role. Mm-hmm. So as we were saying, the laser machine basically shoots in some light energy into your tissue. This light energy is absorbed by specific types of cells or specific organelles within your cells called chromophores. Essentially, they take those photons, which photons are
beams of light.
They take those photons, they absorb them, and this leads to chemical changes within the cell. So the chromophores take that light and say, cell, do things. So what happens with this light energy being absorbed, you can see an increase in cell membrane permeability. You can see the improved modulation of pH, so it really helps with that acid-base kind of cycle, kind of keeps that nice and balanced. And you can see a regulation of ion concentration as well.
Okay, so real talk over here. What does that all mean in like talking therapeutically? Cell membrane permeability, pH, and ion concentrations. What does that have to do with anything that we talk about in the athletic training world?
Yes, so we'll get a little more into that when we're actually talking about how does it work for injury and muscle recovery, but essentially it's cell permeability. Good things, bad things are easy to transfer. So we're going to clear some things out and we're going to add some good things in. the pH aspect, right? You don't want to have a very acidic environment, right? Acidic environment's not good for the cell. It's not good for muscle performance. So you're going to see, hey, if we can kind of modulate pH, keep it pretty, pretty neutral, that's going to be a good thing. Now, those are just kind of talking about changes within the cell. That light energy can actually penetrate into the cell itself, and it gets absorbed by some of the enzymes in the mitochondria. That's right, baby. We're talking about the powerhouse, powerhouse of the cell. In particular, the enzyme cytochrome C oxidase. I know everyone definitely remembers that from exercise physiology and talking about Krebs and electron transport chain. So we're not going to bore you with all that. Just know that enzyme is very important to this process. The reason it's important because as it absorbs that energy, it basically kicks that enzyme into, hey, let's get to work. And what you see is an improved shuttling of electrons, which, if we can sum up the electron transport chain, right, you're just moving electrons so you can create a whole bunch of ATP.
All that energy, baby.
Which is good, especially when we're talking about healing and performance. So remember, increased ATP production. Keep that in the back of your head for the rest of this episode.
Light equals energy. Got it.
Yes. Photosynthesis. No, just kidding. Don't.
We're plants?
No, don't take. See, I shouldn't have said it because now someone's going to log in right now and like, hey, they said we're plants. No, we're not. It was a joke. JK. All right. Next, you also see the production of reactive oxygen species. Now, we've said it on the podcast before, and normally I would say reactive oxygen species are bad news because they can create, like, if there's too many of them, it can create a lot of havoc and cause a lot of degradation in the cell, which means a lot of cell death. But if reactive oxygen species are held, which, by the way, those are basically free radicals, if they're held below cytotoxic levels, they're actually a really strong signal to help get the cell going, to help stimulate the cell and get more adaptation signaling.
So what you're saying is bad things are good in moderation.
Yes, and it's like what we've kind of talked about before with like inflammation, right? Everyone kind of likes to, well, maybe not anymore, but the old view of inflammation was, oh, inflammation's bad, right? We need to shut it down. Well, no, your body needs some in order to heal and adapt. The only time inflammation's bad, I would say, is if it gets out of control or if it's just you're stuck in a cycle of inflammation and it lasts too long.
I mean, inflammation is the first phase of the healing cycle.
Exactly. Your body does it for a reason, right? That's how you heal. So that's why that little caveat about reactive oxygen species. Yes, normally when you're talking about injury and recovery and like, oh, reactive oxygen species, those are bad. We need antioxidants to control that. And that's what I'd say it is. You need to control it, right? Everything in moderation within the body is going to be good. So reactive oxygen species, you definitely need them. You just don't want too many of them. So keep that in mind especially when we're talking about laser. Because when I first read that, I was like, oh, whoa, we're increasing reactive oxygen species?
You're saying laser increases that?
Yes.
Okay.
But the idea is the laser's not like all of a sudden creating 10 million reactive oxygen species. No, it's keeping it still below the cytotoxic level. So it's actually beneficial as opposed to creating them out of control, which would be bad.
So is it basically stimulating them so that the body can send whatever it needs to fight them?
Yes, that's the idea. It's creating the signal.
So, I mean, I think I might have used this analogy before on the podcast, but it just reminds me of, you know, when we go hiking and there are those trees with big bulbous parts to them?
Yes.
That's like when I don't know what kind of insect, but some sort of insect like lays its eggs in the tree.
Yes.
And then the tree responds by sending all of its nutrients and starts building in that area and everything as a response to like trying to heal or whatever because it got stung or because this insect like made a home in the tree. And so basically the tree is sending all of its nutrients there, which is so beneficial for the insect or whatever it is that stings the tree because the whatever, I can't remember. I think it's an insect.
Yes.
Whatever insect ends up getting like a home out of it because all the nutrients from the tree are going there.
Yes.
And I feel like this is what the reactive oxygen species are. It's like the body saying like, hey, here's a little bit of like substance.
Yeah.
So that you can be stimulated to get it out.
Yes.
Like we can send more of what we need to.
Yes.
To get everything.
Yes. So
towards healing.
It's literally the Goldilocks, right? Just enough is just right.
Mm-hmm.
Too much, that's bad. So that's kind of the idea here. The laser's basically giving you just enough, the just right of the free radicals. Now, kind of along the lines of what you're saying is, with the signaling and stuff like that. So now we're going to talk about the immune cell effects, which are immune cells are huge in healing and recovery. Laser has been shown to signal the macrophages to, turn on that whole phagocytosis process. So basically, cracks me up because I wrote it. They get munching. They go, nyah, 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 nyah.
Nerd alert part 2.
Yes, exactly. But that's important because, especially when we're talking about tendinopathies or even just injuries in general, right? You have all this damaged tissue that needs to get cleaned up first, right? You can't lay down better tissue and, scar. You can't lay down an effective scar if you have these frayed, just dead, just junk in the way, right? So you need those macrophages to come in and gobble all that up, clean it up a little bit. And then even the macrophages doing that job signals the next process within the inflammatory process and the healing phase as well. Mm-hmm. So again, it shows, hey, we're signaling cells to, hey, let's do our job effectively. You can also see laser signaling the proliferation of other immune cells. So it's telling them, hey, we need to get here. We need to do our job. Let's go. Again, we already talked about how cell permeability increases with laser. So now these immune cells can actually get to the area they're trying to instead of being like, there's a wall, I can't get there, right? They can actually get in, get munching.
Cell membrane permeability. Okay.
Yep, exactly. And then another cool thing that, kind of going into laser is it actually controls other pro-inflammatory mediators. So like this is like your interleukin 6. I know that's kind of a lot, but also like your prostaglandins. All those mediators increase the pain sensation. So being able to kind of like, hey, keep those at bay, kind of turn those ones off, actually helps decrease pain.
We're done with you guys.
Exactly. We're done with pain. And also, again, it kind of controls that inflammation process, right? So it doesn't get out of control. It doesn't stick around too long, right? It controls it. That's the goal of what we're trying to do.
And it doesn't get rid of it completely. It still allows it to go through its process.
Exactly. And promotes kind of the benefits of inflammation as opposed to, well, I have to take the negatives away, but by doing that, I'm taking the positives. No, this is really kind of like, hey, we're strengthening our strengths and getting rid of our weaknesses.
All right, pop quiz for all the BOC studiers out there. 5 cardinal signs of inflammation.
Pain.
That's one.
Redness.
Mm-hmm.
Heat.
Yep.
Loss of function.
Yep. That's the one I always forget.
Yeah, loss of function, baby.
There's one more.
Don't ask me to do it in Latin, by the way.
In Latin?
Yeah, the pallor?
Oh, I don't think I realized that. Oh.
Uh-huh. Which ones did I say?
You said pain, warmth,
redness,
loss of function.
You have one more. Yep. Boom. On it. All right.
Good job.
Go ahead. Latin, babe. You got the Latin part?
Pallor.
And to sum up the effects of laser, I was going to say inflammation. We're talking about inflammation. I'm all getting jazzed for it now. You might be able to see the increase of nitric oxide, which we've talked about it in previous episodes, especially in I believe it was the dynamic compression episode, how nitric oxide's a very strong vasodilator. So you can kind of get the idea that, okay, we're increasing cell permeability, and we're also possibly doing some vasodilation, which means improved blood flow. Getting that blood flow moving, baby. Pew, pew, pew.
Pew pew. And blood brings what?
Good things.
Like
nutrients, oxygen, immune cells.
warmth.
It does because of the increased blood flow, but when we talk about laser, we're really not going for it. There really shouldn't be a thermal effect. They kind of view it as
I'm just talking about inflammation.
But yes, you're right. You're right, because the increased blood flow does bring heat.
Yeah.
So yeah, true. True, true.
I'm not talking about it heats up the tissue,
There,
but
okay.
it does bring warmth.
Boom.
All right, so let's move into actually how laser affects like performance and injury.
Let's do it. I'm ready. So we're going to start with the performance measures. One area that we will touch on is power and strength measures. And the literature behind this doesn't really show a lot of support that laser improves performance of strength and power exercises.
I mean, if you think about it, it kind of makes sense based on what you were saying.
Yes, go on.
Are you quizzing me right now?
No, you're going to touch on what I was going to talk about, so this is awesome.
Well, I feel like we've been talking about decreasing the inflammation cycle and like kind of keeping things at bay. And that none of those things have we've been really like, okay, we need to like clear out some soreness or like clear out whatever you need to like have a better performance, I guess. We haven't talked anything performance. So
That's true.
I from an outside perspective, I don't see how, I mean, what we specifically have been talking about, how you would relate that to performance is just what I'm saying.
Okay.
Unless
I kinda see what you're saying.
you're just saying like, I got an ankle sprain last week and this week I'm better because of laser, so my performance is going to be better.
Okay. I see what you're saying.
Mm-hmm.
So let me talk about endurance performance, and this will kind of explain the power and strength.
Okay.
The reason laser doesn't really show a lot of support for that. So when we're talking about endurance, right? This is like time to exhaustion stuff.
Oh wait, I got to interrupt you. Except we did talk about energy. We did talk about ATP.
Oh, there it is. So that ties into the endurance part. And again, these are studies utilizing like time to exhaustion, time trials, stuff like that. And there is support that laser may improve endurance performance. Now, there are some conflict between studies, like between like running studies and cycling and like swimming, right? All these other different endurance activities. But in general, if you're comparing an endurance performance or a power and strength, you're more likely to see the benefit in an endurance type of event. And the reason this is because kind of like what you were already kind of hinting at is when you think about the effects of laser, it really focuses on that mitochondria powerhouse. Right? And the mitochondria is very important for endurance athletes. And I mean, it's important for everybody, but it's really big in endurance performance because that's where you get a ton of energy, and that's where those aerobic pathways, occur. Mm-hmm. So it makes sense that laser having such a big role in the mitochondria's function and how it not only creates ATP, right? It's turning on the mitochondria. It's saying, hey, we need to improve our transport of electrons to create more ATP. But now you're also seeing, well, if you get vasodilation and increased cell permeability and electrons are moving, well, there has to be the oxygen to, latch onto that electron. Mm-hmm. You're seeing improved oxygen delivery, which again, for endurance performance, that's huge. Mm-hmm. So you're getting that aspect. And we've already talked about how laser improves that kind of acid balance, right? If you're able to deliver more oxygen, now you're starting to see that acidosis and that can form in these endurance activities start to kind of slow down. You don't get to see it develop as quickly. So it's kind of making sure that that lactic acid cycle, hey, kind of slows down a little bit. So you're not seeing that buildup that can create a very acidic environment, which again...
So then wouldn't that relate to strength?
Not necessarily, because strength and power don't rely heavily on those, the function of the mitochondria, and it doesn't necessarily create a very acidic environment. It's not a long duration to where you're starting to see the buildup of lactic acid and acidosis.
Right. I mean, I see how that you're talking about endurance,
Yes.
but I'm talking about like after you're sore.
Ooh, we're getting there.
Okay.
Man, you're picking up what I'm putting down.
So, actually, that made me think about something.
That's what this podcast is for. Food for thought.
Okay, so I hear you when you're saying that it helps with oxygen and helps with all this endurance stuff. But how long, I guess, how long does it last, or when do you have to apply it? Because obviously, like, someone's running a marathon, you're not going to be like, here, take this laser as you're running.
They have talked about that being a limitation, that you can't really do that in the field. Some people have shown the effects could last about 24 hours, but I would say it's about the same as kind of like what other modalities kind of do. And most of the studies that found this kind of benefit as an ergogenic aid applied it before the activity.
Okay. That was going to be my next question.
Yes.
So, like, do you have to do it before, or do you have to do it after you build up?
So
I guess after you build up, and then if you can't do it in the field, that's kind of like...
Yeah, so for the ergogenic effect aspect of it, they did it before the activity. So they applied it and then they tested them. Now, as far as so when you're talking about power and strength, right, we're talking about the literature that literally scientifically analyze strength and power, right? So you're talking about how much force can you produce at one time, or power, wind gate, stuff like that, right? Like, yes, those are very obviously great measures of strength and power, but that's not really
what we do for sports.
Yeah, all right. You don't do that. Like,
what are you talking about? I just watched the Wingate races last week.
Oh, you did? Are your football players too on the Wingate out there? Right? Like, that's not. It's just it's not like ecologically valid, right? Like, it's not exactly what's happening in sport. So if you look at the literature that looks at like team sport stuff, right, it's very mixed, as far as like, rugby performance, like soccer performance measures, stuff like that. Stuff with that, like, kind of repeated sprint, kind of long duration. Like, it's kind of a mixture of all things, like power, strength, and endurance, right? It doesn't, some say, yes, it's good for that. And some say, well, it didn't really do anything. But consistently, it definitely makes the athlete feel better.
That's good.
Right? The rate of perceived exertion does tend to be lower of the athlete that had laser. And the nice thing with like laser is, because there's no heating element to it, there should be no sensation that the athlete's feeling. So theoretically, this modality is really easy to blind. So you can give someone a true placebo and give them a true treatment. You can actually find results from the treatment. And that's what the case. Those people who actually had laser tended to feel they weren't working as hard at these later durations than someone who didn't have the laser. So keep that in mind. It is definitely good for endurance type activities. Hey, laser, 2 thumbs up. But like, as you're applying this to your athletes, right, don't immediately throw it out because like, oh, well, I have a sprinter. That's not an endurance. Well, right, if you have a 400 runner, well, more than likely they're running the 4, they're running the 2, they're running the 4x4, the 1, right? They're doing all these other things, right? They have to have some kind of component of endurance, right? They're not running the 10K, but still, right? So laser still may be valid for them, especially if it just kind of makes them feel a bit better. Hey, there's an opportunity where maybe they get a little bit better.
Or it's also just a really short treatment plan and you can just try it.
It is, right? The treatment durations are very quick and you could see good results. And again, we need to highlight, there's going to be some people who are very objective and say like, oh, well, all it did was make them feel better. It didn't necessarily improve performance. Statistically,
making someone feel better is invaluable. And
100%.
I could argue that's what we are supposed to do as clinicians.
100%. And also, you have to remember, again, this is talking statistically. But statistically doesn't account for that 100-meter race where the guy just won by 100th of a second.
Yep.
Statistically, is that significant? No. But
Yeah, let's put stats on the race.
But right, like that 100th of a second could be the difference between winning gold and taking home the silver, or even getting on the podium, or that $1 million contract, right? So yes, we still have to, see, okay, well, statistically, does this work, and kind of look at it. But there are some benefits, and if my athletes feel like they're not working as hard, hey, maybe they can get a little bit better of a performance. So I would argue, even though strength and power, not super supported, maybe for some of those athletes, it might not be a bad idea.
Let's talk recovery.
Yes. This is what you were hinting at as well. Laser, again, there's some pretty good support that laser is good to recover from DOMS. And the reason this is because, one, we're talking about that shuttling bad things out, right? That vasodilation, right? You have a bigger tube to pump all the bad things from exercise out, right? So all those metabolites, all that increased lactic acid that, built up, all the creatine kinase that, got thrown around because, some damage to the muscle, that's all getting shuttled out.
Open the freeways.
Exactly. And there's a lot of people that will kind of talk about, lactic acid, that normalizes quickly. So I'm not too worried about looking at that. And that's true. It does. Your body's going to normalize that really quickly. And
I think that's what I was kind of thinking about when I was thinking about you talking about strength and power.
yes.
Was kind of just like, oh, you build up lactic acid and you want to clear that out. Not like specifically, like, does it help with just performance?
Yeah. Yeah. So, a lot of people are like, well, why are we looking at that for recovery? Your body, it shouldn't be super important. Your body shuttles it really quickly, and your body does like lactic acid. It's a good energy source. It can be shipped to the heart for energy. It can be shipped to other parts of the body, other working muscles. The body can use it, reverse it, and there you get some energy out of it. But to be able to do that faster, I would argue is pretty beneficial, and it helps kind of keep that acidic environment lower. So I would still argue that, yes, your body does normalize it pretty quickly on its own. But if we could do it a little bit faster, I would still say that's pretty beneficial to recovery, especially if you're talking about people who are going through multiple events through a day or the next day, right? Again, sorry to go on the track theme, but it's what kind of comes to mind, right? Like your decathletes, right? That's an all-day thing, right? And guess what? They're going to do the same thing tomorrow. So it's, it's a taxing event. And so events like that, hey, this could be beneficial. And hey, creating a little bit less acidic environment, that could be pretty good. But along those lines, as far as DOMS, right, what's the one characteristic of DOMS? You don't feel good.
No, ouchie.
Yeah, exactly. Ouchie. And kind of what we talked about in previous episodes where we've talked about DOMS is there's definitely a pro-inflammatory component to this that involves those mediators that increase pain, right? Prostaglandins and all that. All those mediators say, let's raise the pain, right? So I know you liked it.
Meteor's having a rave over there.
Because they're increasing the pain. So we've already talked about how laser can actually turn those off, and that's why you also see an improved recovery from DOMS, right? If you're able to shut down those prostaglandins from increasing pain and all those pro-inflammatory mediators that do the same thing, they increase that pain sensation. If you can kind of shut those down or kind of slow them down, you're going to see a decreased level of pain, which means less DOMS and technically improved recovery.
So we can do it all again tomorrow. Exactly.
And again, to touch on the immune cells, right? A part of that recovery process is we need to start the healing process, right? DOMS is basically like a minor muscle strain, right? So there still has to be some kind of inflammatory response to help heal the tissue. Well, again, laser is perfect for that, to tell the immune cells, hey, get munching so we can lay some scarring down and get better.
Yeah, clear the way.
Clear the way. So when we talk about recovery, it's always a good segue to kind of getting an idea of what happens in actual musculoskeletal injury. Because again, DOMS is
basically a micro injury.
Yeah, it's just a baby injury.
I'm just a baby.
I'm just a baby injury. So it does give that kind of nice window onto, okay, how do we think this is going to work for like a larger injury? And the literature does show a little support for laser in improving pain with tendinopathy, hamstring strains, and even knee osteoarthritis.
Interesting.
And again, a lot of that kind of ties into how it affects inflammation. Right? If you're able to really modulate inflammation, kind of get it through that process, control it, you're going to see a decreased level of pain, which is important, especially for athletes and certain conditions like knee OA and stuff like that, right? So pain's going to be one big area that controlling those mediators that increase pain, you're going to see, hey, we're going to get a lower level of pain. But then you also see those aspects of the immune cell function. Again, you're really kicking that healing process into gear. Now, when you dive into some of this literature that looks at these like pathologies, a lot of times, right, we're talking about they did well in pain and maybe some function stuff, but there's not really a lot that really highlights that it made them return to play faster or it had a lower re-injury risk. So when you look at it that way, you're like, oh, well, did laser really do anything more than what our normal stuff does, what I normally do? And my response to that would be, one, when do we ever just do one treatment?
That is the problem with a lot, I feel like.
Yeah, here we go, laser, boom, that's it, done.
No rehab for you.
Yeah, right? We don't do that. We combined a lot of treatments.
I feel like the athletes would want that.
Yeah, they wish.
One and done.
Yeah, they wish they had a pill that could make them feel better or make their injury heal, right? But, right, that's not really what we do. And there was a really interesting study that did look at the hamstring strain, and they did pair it with kind of like what we do, right? They paired it with a rehab program and all that, which is again what we do. And they showed there was no difference in time to return to play, and at 6 months follow up, there was no increased re-injury risk. But if you dive a little bit deeper into kind of results like that, one, we don't know what happened 6 months after that follow-up.
Right.
Right? Like a lot of us have our athletes for, a couple years at least or more, right? And you want to try and reduce that risk of re-injury forever.
Forever.
Exactly. Right? So it doesn't give you an idea of, okay, how much did re-injury risk truly get affected? But also, these studies do have strict discharge criteria. And as clinicians, we should also as well. We should have a nice hey, you've hit these objective measures. Subjectively, you feel this, this, and this. You should be good to go. You can return to play.
Tell me when sports comes right out in the textbook.
I was just going to say, but unfortunately, sometimes just the athletic environment doesn't allow for that quite nice return to play. There's sometimes certain situations you have to be a little bit more aggressive than what you would like to be. That puts the athlete, the risk of re-injury might be a little bit higher than what you would have liked, right? Sometimes it's the athlete wants to play in this game, right? It really means a lot to them. This is
the last time they're going to play.
Sophomore or senior night, right?
They're not going to play at the next level.
Yeah, or hey, this is the championship game. I gotta play, right? There's certain criteria that again, if we're treating the patient as a whole, that we have to take into account. So sometimes...
I like how you put that.
Yes. So sometimes that strict discharge criteria sometimes isn't the reality of athletics. So what would be nice to see is, how did laser affect them during the treatment? Did they feel better sooner? Okay, well, that's some important information, because if they feel a bit better, hey, there might be some compromising, okay, we might be able to start doing this, this, and this. Right? They didn't really talk about that in that study. So I think that's an interesting part that if you kind of read that at first glance, it's oh, well, yeah, like laser's cool because it helped with the pain and stuff. Like they felt a little bit better, but it's just like at the end of the day, the rehab was they got to the same place. So like, why am I spending $3,000 on this unit? That literature didn't really touch on some of those more minute stuff that as clinicians we have to make our best clinical judgment each day.
Right.
And if I have a modality which definitely has a lot of promise to it that might be able to make my athlete feel better sooner in their rehab, there might be a chance they can do more sooner than if we didn't have that modality. Mm-hmm. And again, our job is to create the best environment for healing, create as good of a, healed tissue as possible, and be able to rehab them into a better position. Laser might be able to do that for you.
And like we individualize every treatment plan, we can also individualize modalities. So some people it's going to work better on than others.
Exactly. 100%. So with us talking about injury right now, we need to know how to use the machine. And
finally, actually, that brings up a good point because I put up on our Instagram story earlier, just asking if people who just in our community, if our athletic trainers have had or currently have access to laser.
Yeah.
When I checked it earlier, it was literally, I don't even know how this is possible, perfectly split down the middle, yes and no, 50-50.
Interesting. You know what's funny is
and that was like a couple hundred
when I last checked. When I was a student, I felt like laser like no one had.
That's what I thought.
Like
too.
I felt, and even in modalities, I feel like we just like
breezed over.
Here's laser, cool, okay, moving on.
Yeah.
Because like it just felt like, well, no one has it. Mm-hmm. But I've been to 2 places now that have it, and finally at a place that has it. So I'm ready to go, and I feel comfortable with it. Pew pew pew.
I have access, half. I have half access.
Yes, you do. Pew. Just one pew.
Yeah.
Just pew. So, the literature definitely is all over the place on the parameters to use for laser. There's such a wide range of ways to use it. But from what I was reading, it seems like the best results were found when you have something that has multiple wavelengths. So when we talk about wavelengths, we're talking about, right, this is on a scale of light, right? And light travels in waves, right? That's how, right, the blue, the ultraviolet, all that stuff, right? So that's what we're talking about when we're talking about wavelengths. And the best results are kind of ones that have multiple. This is your cluster diodes, the ones that are like, oh, it's LED and it's infrared. Like it's basically all in one. Mm-hmm. Right? Those show the best because certain enzymes within your cells react differently to different waves of light. So if you have multiple waves of light, you're getting more enzymes.
Your shotgun approach. It's your multivitamin.
It's your multivitamin. Yes, you're right. Next is kind of like what kind of total energy are you going for? And there's different ways that they've measured it, but the easiest way that I've been able to understand it is through joules, which is basically just a measure of energy. And the total, about 30 to 60 joules total energy in the muscle has kind of seen those good results. You might need more, like a higher total level of energy for larger muscle groups and maybe a little bit smaller for your smaller muscles. But in general, you're trying to get that total 30 to about 60 joules. And this is like adding up. So you're not just going to like you can, but like a lot of the literature that I've seen kind of divide it like, okay, like if I'm trying to get 30 joules, I'm going to do 1 joule per site in the muscle. So I'm going to do 30 sites in the muscle.
Oh, wow.
Like something like that. I mean, they didn't do it quite like that, right? It was more like 5 sites. So, right, it's like X amount of joules for like a minute or so.
Okay.
Yeah. But like, that's the idea. You're trying to total up to the 30 or 60.
I was going to say 30 minutes, that's long.
No, it wouldn't be like that. So you can adjust it to like, oh, I'm going to go to 6 sites for a minute. And there's a 5-minute treatment.
6 minutes.
6. Did I say 5? Yeah, 6 minutes. It's late. Apologize. Right. So like you're just trying to add up because it's the total.
Right.
And then the time, again, everything I've seen, it just seems so varied. But a lot of the studies that I was seeing that like actually showed the benefit part they were about a minute per site.
Mm-hmm.
Probably sat around a minute.
That's what I've seen.
So
30 seconds to a minute I've seen.
yeah. And a lot of these machines now that I've noticed kind of like have their own preset. Like you put in the joules and it's like, oh, it's this long. So if you kind of feel uncomfortable, hey, you can kind of go with the machine. I never liked the machine telling me what to do. I like to customize, and
Of course you didn't.
I'm the clinician here.
Of course. Nerd alert.
I don't need
the.
I don't need the machine telling me what to do. But hey, if it's kind of a situation where you're just like, man, I don't know, I don't really feel comfortable adjusting it. Hey, the machine does have that nice little pre-programmed setting to like.
It's like your Mark Pro versus your
exactly
Chattanooga Stim.
Exactly. You can at least feel comfortable that I'm not doing anything detrimental.
Mm-hmm.
So
can't burn someone with laser.
Exactly.
Maybe those kinds of lasers.
Yeah, that's true. Star Wars, and we're back to Star Wars. But yeah, that's laser. I'm excited to finally be at a place where I can use it. Doing the reading got me really excited to like just spitballing on different ways I can do it. Like, shoot, like even the aspect of recovery and like just maybe endurance performance, like just thinking of how that might improve rehab.
Mm-hmm.
Right? If I can improve maybe a little bit of endurance in my my patients, hey, maybe I can do a little more work that day.
So there's like a typical modality. You might do it because it's pain relief and decreased inflammation. You can do it at the beginning of rehab to kind of
okay, and because it's good for pain, and it definitely shows those controlling those pro-inflammatory mediators. You could definitely use this really early on.
How instantly do people feel better? I know you said that before, but I'm skipping it in my brain.
With like the recovery studies, right? They measure them each day.
But I mean, like, someone comes in, you do laser, and then they do rehab. Like, are they going to feel better for rehab, or are they going to feel better after the whole treatment session?
Ooh, that's a good question. That's a good question. My thinking is they'll feel better during the rehab session. They'll feel a difference there.
Okay.
I don't know if they're going to, like, once the treatment stops, they're like, oh, man, feel fired up, ready to go.
Depends on the cells.
But also, like, I haven't been able to implement laser that much in my practice yet.
Right.
So that part I am excited to see. Just my brief interactions with laser, I haven't seen that instant, like, oh, man, feel amazing.
Right.
But also with a lot of modalities, too, there's not a lot of modalities that even do that, right? A lot of times once stim, once you kind of turn it off, it kind of comes back. Yeah, there might be a little bit like, oh, I still feel okay, but then they get moving and they're like, oh, it's back, right? Depending on the stim you use.
I mean,
depending on the pain modulation level.
I think everyone would be fired up after those just real timeless glasses you get to wear.
Oh, with the laser? Mm-hmm. Oh yeah, I forgot about that. Yeah, please wear your please wear the stylish glasses that do come with it, because there is the danger of eye injuries. So yes, I'm glad you brought that up. Yes, please wear the stylish glasses. And if you don't, just make sure there's a nice protective barrier that you can't see the thing.
Don't look.
I've seen people.
It's like Medusa. Don't look.
I've seen people put like a towel over.
Just wear the glasses.
Yeah, wear the glasses. They are stylish. They are stylish.
How many references do you use for this?
About 15.
That's pretty good.
Yeah, we did good. We did good on this one.
So if you want to find those references, they're on our website, down in our show notes, which is also where you can find the CEU link. If you can't find it, email us at atcornerds@gmail.com. So down below, you will find the CEUs. You put it under Precision AT.
Yes, it'll say like click here. I can't remember off the top of my head, but it'll say like click here for your CEUs and course evaluation, and then it'll have the link.
So you do the course evaluation. You also click on the link. The link will take you to the purchase page. Depending on whether it's free, $1, or regular price, you will see that reflected. And then go ahead and purchase it, even if it's free. And then It'll take you through. You can do the course quiz, which you can do unlimited times. You'll get your certificate, and that's all.
Yes.
Pretty simple, straightforward.
Yep.
So if you guys are new, we do every other episode as education or stories. This one was an education episode, and next week we are going back to our story episodes where we share stories from real-life athletic trainers. And if you want to submit your story, go ahead and go to our Facebook group at facebook.com/group/ATcornerPodcast, or follow us on Instagram at ATcornerPodcast, where we post upcoming story prompts about a week before the episode premieres.
Yep.
In our Instagram stories, by the way.
Yes.
And I think that is it, Randy. We did pretty well.
We did.
I thought this was going to be short. We just like to talk about laser.
Yeah, we did. Yeah. Well, we had good back and forth with it.
Yeah.
All right. Thank you for helping us showcase athletic training behind the tape. Bye.